All right, well, good afternoon, everyone. Let me first of all thank you all for being with us today, and certainly want to thank Dr. Toomey. Her medical director, Dr. Peacock, is with us as well today, and of course, Director Stallings. And Dr. Toomey and Director Stallings will both be providing an update, and will be standing by to answer any questions you may have when we get finished. Also glad to have our First Lady today. She's been working hard on our parts of our legislative agenda here at the Capitol, so we're glad to have her great support and great work that she and the Grace Commission and many others are doing here in the building. I wanted to first of all take a few minutes and update you on a data reporting issue that Dr. Toomey's team in my office have been discussing with the CDC. Over the last week, we have collectively worked to identify and confirm at least 250,000 doses administered in Georgia through the federal pharmacy program that have not been reported to the state system or to the CDC administered here in our state. These doses counted against us in the number of shipped vaccine doses, but did not count in the number of those administered. This statistic, including doses administered per 100,000 residents, is one of the top metrics the media has focused on in the last couple of weeks. We have confirmed with the CDC and the White House coronavirus team that the doses were administered, but that they were not reported as administered here in our state. As of today, we're still working with the CDC to identify the exact number of doses this applies to. Until we know that data point, we do not have a full understanding of how badly this issue has affected Georgia when the media compared us to other states. We are working with our partners at the CDC to rectify it as soon as possible, and we hope it will be resolved by the end of the month. Even with at least 250,000 doses that aren't being credited to Georgia, we continue to beat the national average in vaccinating the most vulnerable to COVID-19. As of today, we are nearing 1 million seniors having received at least one dose, or 70% of our over 65 population. The national average is 64%, according to the CDC data. As a reminder, Georgians over the age of 65 account for 77% of our deaths due to COVID-19. This targeted approach to protect our seniors is saving lives. The media and those playing pandemic politics will continue to focus on whichever statistic of the day paints Georgia in a bad light. But I will tell you, I'm not worried about politics. I'm worried about following the science and the data about who is most vulnerable to transmission, severe illness, hospitalization, or even death at the hands of COVID-19, and ensuring that these individuals have access to the vaccination program. Those are our seniors, those with high-risk health conditions, our frontline medical staff, and our first responders. To remind everyone, our current eligibility accounts for categories of Georgians who represent 92% of COVID-19 fatalities in our state. And it is clear from nearly every COVID-19 data point, cases, hospitalizations, and percent positive tests, that our targeted approach to vaccinate those populations is paying off. The state continues to receive reports of providers holding doses for a variety of different reasons, including to ensure they have enough second doses on hand for those appointments. Given the drastically increased supply of vaccines from the federal government, providers should be getting those shots administered as quickly as possible. That's why my office, in conjunction with the Department of Public Health, today is sending a letter to every provider who signed up to receive vaccines from the state. We expect providers to be utilizing no less than 80% of their weekly allocation of first doses within 7 days of receiving those doses, and also reporting administration to the state within 24 hours. Again, the Biden administration continues to provide consistent vaccine distribution information to the state, so there's no reason for providers to withhold doses. Moving forward, we'll be prioritizing future allocation of doses to providers based on provider inventory, effective distribution, and partnerships with local community organizations in future allocations of doses out to those providers. This week, the state received 458,000 vaccines for both first and second doses, and that includes 11,500 of the Johnson & Johnson vaccine. We expect next week to either be the same allocation or potentially a small increase. However, we are planning for a large increase in supply from the Biden administration beginning the week of March 29th, especially in the Johnson & Johnson vaccine. And finally, we're encouraging every eligible Georgian to please make their appointment as soon as possible. The demand for vaccine is significantly lower south of the Columbus, Macon, Augusta line than it is in metro Atlanta and much of North Georgia. The state has and will continue to reallocate doses to meet the differences in demand we are seeing geographically. Working with Chief Justice Harold Melton and the Department of Public Health, we'll also be adding judges and courtroom staff to the list of eligible Georgians for vaccination that will be effective today. Given the significant case backlog our courts are experiencing, we believe it is vital to get the third branch of state government back operating smoothly and safely. We will be moving quickly, as I've said in press conferences before, over the next couple of weeks to expand criteria in order to ensure we don't have vaccines sitting on the shelf or in a freezer somewhere. If you are over the age of 55, you are eligible. If you have a high-risk health condition like asthma, obesity, heart disease, or any of those currently listed on the Department of Public Health's website, I want to encourage you to schedule your appointment today. Vaccination is our ticket, as you well know, back to normalcy. The more people who are vaccinated, the more lives we save, and the quicker we can all get back to our normal way of life. Over the next couple of weeks, the First Lady and I will be getting vaccinated, and I want to encourage all Georgians to do the same. I'll now turn it over to Director Stallings for a brief update. Director Stallings.
Thank you, Governor, Ms. Marty, Dr. Toomey. Quick update is obviously our 4 sites that we already have up and running are still conducting vaccination today, but we also are happy to report that tomorrow we will begin at our new 5 sites. They're ready to begin because of the work that we have done along with Georgia National Guard, Department of Transportation, Gulfstream Aerospace, many other public and private partners, and most definitely the Department of Public Health. We're excited to be vaccinating more Georgians. To date, or as of noon today, we've done 56,420 first doses and 5,820 second doses. So we're extremely excited about that. By the end of next week, we will have done an additional 34,700 plus first doses, and we'll be more into our second doses, hitting around 24,000 people. Something that we do want to bring up that's very important is that we've stressed since the beginning that our sites are appointment only. And we get that some folks on the first few days traveled to Albany and some of the other sites to get their first dose, and they decided they didn't want to travel that far for their second dose this week. So they've started just showing up, and it's important. Yesterday we had close to 400 people show up with no appointment at our site. So it makes it very difficult if you don't have an appointment, makes the allocation process a lot more difficult. So please make sure you have an appointment. We were able to handle those because of some offsets where we had moved allocation, where the Albany site was not producing what it should have been. So we kind of had an idea that that might happen, but we were able to go there. But please make sure you have an appointment. The great thing about the Pfizer vaccine that we're doing is you have 21 to 42 days to get your second dose. So if you don't get an appointment exactly on the 21st day, it's all right, because if you weren't willing to drive, someone else, you might have taken an appointment that someone else was expecting to get. So make sure you do that. Secondly, we want to make sure we hit that if you're under the age of 18 and you come to one of our sites, please have a parent or guardian with you to get your vaccine. You're required to fill out the eligibility and parental consent forms, so you need to have those with you. As the governor said, we know the keys to beating this virus are a combination of vaccination, hand washing, social distancing, and wearing masks. And for us, we are doing our part. We're excited to be a part of the team, along with Dr. Toomey. And once again, I just want to make sure if you go to My Vaccine Georgia, you're only going to come to our 9 sites starting tomorrow. There are also appointments, and Dr. Toomey will probably hit on it here in just a moment, that are available at public health sites. Just make sure at both of these locations, if they're asking for an appointment, you make it. That's something we are bumping into. So if you'll get those appointments, it can ensure that we'll get you through efficiently. Yesterday, we're proud to say that even with over 400 extras, about the longest wait was 30 minutes. So we're still pretty excited about our efficiency. That's all I got, Governor.
All right, thanks, Director. Dr. Toomey.
Thank you, Governor. I just wanted to hit on a couple of high points that we've talked about before, but I think are worth repeating. One is, if you look on the DPH website, dph.georgia.gov, you can see all this, you can click on a link that talks about all the sites where they are currently have vaccine, as well as how to schedule at our many sites throughout the state, as well as the private sector sites, such as Walgreens, Publix, Walmart's, Kroger, Ingles. And we looked at this availability, and with the additional availability now, with the GEMA sites coming on board tomorrow, there's a lot of availability now. And it's just so important to be vaccinated. As the governor said, this is going to be our freedom in Georgia, to be able to get back to the Georgia we want to be. And I think if you look at the cases in nursing homes, long-term care facilities, that really tells a story of what we can expect for the state as a whole. If you remember, every press conference we had, I talked about outbreaks, and the leading site for outbreaks in the state had been previously in long-term care facilities. And this week, when I checked, there weren't any outbreaks in long-term care facilities, and that reflects the fact that the majority of those long-term care facility residents are now vaccinated. And I think that is what our goal for the state as a whole. And that is how we're going to stop transmission. So I really urge you all to make your appointments when you're eligible, and we can move ahead as a state. We are seeing our positivity rate go down significantly to about 5%. And this is a good sign. We would like to keep it down and keep it declining in the weeks ahead. And everybody being vaccinated will allow that to happen. We are vaccinating, as you know, individuals with health conditions from 16 years old into adulthood, and we recognize that these individuals with multiple health conditions may have a higher risk of having complications if they acquire COVID. And one of the many groups, including asthma, cancer, COPD, those with obesity, those with diabetes, as well as those with weakened immune systems, are all eligible for vaccination now. And I've gotten many calls and many concerns that individuals with lupus or individuals with rheumatoid arthritis weren't specifically mentioned. But because those conditions often are treated with medication that may lead to some immunosuppression, they too are also eligible during this time. So please be sure to let your friends and family know if they have lupus, if they have rheumatoid arthritis, or any condition that may lead to a diminished immune system, then please be vaccinated at this time. We're continuing to work with a lot of partnerships, both for the elder community, ensuring that they have transportation to sites for vaccination, as well as those individuals with developmental disabilities, and also working on ways to transport these individuals who may not otherwise have a way to get to the vaccination sites, including our partnerships with Walgreens that we'll be rolling out next week. I'm also very pleased to say that we've been able to identify at least 3,000 individuals statewide who are homebound and therefore would not have been able to be vaccinated at one of our sites. And we are working out through our public health departments and other partners in the community, vaccinating those homebound individuals throughout the state in the days ahead. And so that's a very, I think, an important opportunity as well for those individuals likely at very high risk for acquiring COVID if they were exposed. And also as an example of how we're trying to work with all of the communities at risk for COVID, I wanted to say that my partner up here, David, and I filmed a video that should be on our website now or will be shortly, as well as the governor's website, with information about the vaccination and how to get it and what to expect with the vaccination, so that everyone, regardless of their abilities to hear or read, can get that information. So that's all I had for today, and thank you very much. No, I didn't. No, I also wanted to mention that our Equity Council met last week. It was a very, very lively meeting. We have 16 members from all over the state, representing many communities of color. And I think what was the exciting thing about that meeting is that there were 16 members, all with 16 different new creative ideas about how we can reach communities, how we can use their influence and their leadership in the community to set up special testing events, how we can begin to get people more comfortable with the vaccines and what they can provide, the freedoms, as it were, that they can provide. And we are actually going to be setting aside some vaccine to ensure that we can work together with the council for some of these special testing events. For example, last weekend in Gainesville, one of our members, Norma Hernandez, was able to do a very special event, and she got over 1,100 individuals in that community to come to that special pop-up site. And it's that kind of event that we're looking to do in special communities, those where there's some hesitancy or some inability to come to our established test sites, and can make it easier to get the vaccine for them. So we're going to be continuing meeting every several weeks, and we'll be using those ideas to help us get additional opportunities to vaccinate in hard-to-reach communities throughout the state.
Thank you, Director Stallings and Dr. Toomey. Just before we open it up to questions real quick, I just wanted to remind everyone, especially the media markets outside of the metro Atlanta area, with these additional sites that we have opening up tomorrow, we'll have 9 state sites. We have a lot of availability in that Augusta, Macon, Columbus, South line. Please push that out there. Encourage your local citizens and local communities to sign up, to go ahead and get their vaccine. There's a lot of availability through the federal pharmacy program and other providers in those parts of the state as well. And there's also, quite honestly, vaccine hesitancy in many of those rural communities across the state. And I would urge those Georgians, contact your medical provider, your doctor, your pharmacist, other people. If you have questions about this vaccine, it is safe, it is very effective. I was with Dr. Montgomery Rice from Morehouse School of Medicine last night. We were further talking about her work with Dr. Toomey's team and the educational piece that they're doing, especially in the African American community, to make sure that people are comfortable getting the vaccine. We need to do that in all parts of the state, so I would encourage you to help us spread that word and encourage all Georgians to get their vaccine. Thank you, John.
Governor, do you have an updated timeline based on all your projections of when you might open up the vaccines to everyone in Georgia? You said April perhaps, but
Well, yeah, I'll continue to stand by that, but you can see by today's announcement, we continue to remain very nimble. We're prepared to move very fast like we've done with the judiciary. As we see that supply increasing, certainly, as I mentioned in my remarks of the Johnson & Johnson vaccine, that just opens up a whole different ball game for us to be able to go into, neighborhoods, civic clubs, churches like we saw at St. Philip AME this week, but do one dose versus having the schedule coming back, 2 weeks, 21 days, or what have you after that. So I think it'll give us a lot more flexibility. That's one reason we're encouraging our providers to do that is the same. If they're not seeing the demand, then they need to be working with partners that can have that trust in the community to bring people in. That's exactly what Walgreens and St. Philip AME did. It's exactly what Piedmont did yesterday. It's what Norma Fernandez did up in the Gainesville area with the Latino community. And we are getting closer to that day. So I still feel very good about the original timeline I put out there.
One question about the past year. A year ago today, you declared the schools should be closed. 2 days earlier, March 14th, 2020, you issued your first public health emergency and activated the National Guard. I know you like to look forward, but as you look back over the past year, the impact this has had on all of our lives, what do you wish now that you'd known then that with all the tough questions we've asked you over the past year that you could have known, and how has this impacted you?
Well, I'm not going to try to go back and second guess myself or the things that Dr. Toomey and Director Stallings and former Director Homer Bryson and many other people that were part of our team went through. There's no question about it. We had to make some very tough choices during extraordinary times, and there is no playbook for this. But every Georgian, I believe, I know our family has been affected by COVID-19 in one way or another. Many of us have experienced loss of close friends and family, and our heart continues to break for those individuals. It pains me at the suffering many of our small business owners and hardworking Georgians, through no fault of their own, have been affected. Our kids' inability, even recently, to be in a classroom will have generational effects on our state and on this country and on the world. But I will tell you, looking back 1 year, every day is a reminder of the things that we went through, the tough decisions we made, but it's also reminders of those heroic days when we literally had Department of Natural Resource Rangers, state troopers, National Guard flying, delivering PPE when hospitals had none, setting up temporary medical facilities, working with our school systems to make tough choices. I mean, I am so proud of my fellow Georgians for how hard they hunkered down to fight this virus and to be standing in the position that we are in today in our state, continuing to protect lives and livelihoods and focusing on the people that are in this chart that show that 77% of our fatalities have come from those over 65 years of age. I'm very proud of what this hardworking team has done, and certainly Dr. Toomey's work and many, many other people that you never see at a press conference or on, any television camera, but the people that are out there in our public health departments, our hospitals, our nurses, our educators, people that are delivering meals on school buses, our National Guardsmen who have been volunteering for over probably close to a year now in our food banks when it wasn't even safe to have normal volunteers be in there. There is so much heroic work that has gone on. It makes me damn proud to be a Georgian.
Hi, Governor. Regarding the data glitch that you mentioned that shorted Georgia's being credited for 250,000 doses so far, the federal pharmacy program is nationwide. Did that data glitch not affect the entire country, every state, or was it just us?
Yeah, I wouldn't really be able to speak to any specifics. I haven't been, we've been working on this data issue. I'll let the team give you more information after we wrap up here. I mean, I feel certain it's affected other states. How it's affected us, I don't know. it doesn't change my mindset, what we're focused on. We're continuing, as you all know, to focus on the most vulnerable, to focus on the medically fragile. And as we get more vaccine, we're going to open this sucker up to everybody, and we're going to continue to get the vaccine out. But I do think it's important for all of us to continue to encourage education on how safe and effective this vaccine is. I would be kidding you if I didn't tell you I'm concerned about the differential that we're seeing in the metro areas versus what we're seeing specifically in South Georgia with the availability of appointments, the hesitancy or the lack of initiative, whatever it is for people to get vaccinated. We have great opportunity for that to happen right now for those that are eligible. And to be clear, we are going to move these doses where the demand is. And we are going to ship doses to where they are being used most efficiently. And that is my message today to our citizens and also to our providers.
And the second question, to what you were just talking about, we heard from a number of Georgians who were highly frustrated in Metro Atlanta yesterday. You and your colleagues have repeatedly encouraged Georgians to make appointments.
Right.
In Metro Atlanta, they were trying, and all of the slots filled up. They were all on waiting lists. So all of the sites that you're opening up tomorrow, except for one, are not in Metro Atlanta. What can you do to, what would you tell those people in Metro Atlanta? Should they be trying to make an appointment even?
Well,
Is it worth it?
I'll be glad
and how
to
many
tell
are
them,
on the wait list?
Yeah, I'll be glad to tell them exactly what we told them at the last press conference when we announced this. We knew that we were going to create great demand in the metro areas with the increase in eligibility. We warned people the last press conference before this started to be patient because we knew that was going to be the case here, which is why I encouraged, and I think some people took this the wrong way, that people in the metro areas, if you have the time, if you have the availability, obviously people that are working do not, but others that may be retired that are now in the eligibility may have the ability to drive an hour or two to go get a vaccine at a site that is available. There's many of them in those areas that I mentioned. We saw that with our 10,000th dose at Habersham County, the site. It was a teacher from Brookhaven that had traveled. Some people want to do that. Some people don't. Some people can. Some people cannot. I understand that. But we warned folks, as we did when we started, that we would be creating a lot of demand. We had a fair amount of demand before we even opened up the eligibility, but also didn't want to have doses sitting out there and not have enough people to be eligible. We'll work through this very quickly, as Director Stallings said. We're doing all that we can, and if you look at the state sites, we're getting every dose that we're getting in an arm. My message to providers that are sitting on doses or holding them for second doses or not having demand, they got to figure out how to have partnerships that will make those vaccines available. Work with the local church. Work with the local Chamber of Commerce, homeowners association, senior citizen group, whatever it is, let's get the shots in arms. We know that shortly we're going to have more and more of the Johnson & Johnson, and we'll be able to do more at our mass vaccination sites. We got the federal site that's going to be open that we're working with FEMA on, and Fulton County and other people at Mercedes-Benz that will be coming online. We continue to ship doses to all providers in the metro Atlanta area, and we'll continue to focus on that as the demand continues.
And that last question, how many are currently waitlisted?
How many are what?
Are currently on the wait list for a vaccine?
Well, there's one more than there was because I registered earlier today too, because I've been reading where people were having a hard time registering. So right before I got to the mansion for a lunch engagement I went on My Vaccine Georgia. I signed up. It took me 2 or 3 minutes. When I left lunch, I was checking my email on the way back to the Capitol. I'd already gotten my email saying I had been signed up and that they'll be in touch with me. So the folks that are having trouble in other areas, I would have to know more about whether that's a county site, whether it's a private sector site. But I would encourage Georgians as well to go to myvaccinegeorgia.com, call that phone number that's on the website. As Dr. Toomey said, check the public health sites, but don't forget about your local pharmacy. Great great corporate partners in Georgia: Kroger, Publix, Ingles, Walmart, you know, CVS, Walgreens. Everybody is working hard to get the vaccine out.
I kind of want to ask a question in that vein. All these multiple attempts, you go to myvaccinegeorgia.com, you go to the individual health departments, you also go to the Walgreens, the CVS. Is that causing some of the traffic itself, clogging up the system? And if you have all these multiple attempts to get an appointment and you choose one, or one chooses you, what should you do? Should you go and then cancel your other requests?
Do you want to speak to that, Dr. Jimmy?
I'm so glad you asked that question because came up just a few minutes ago as I was talking to the health directors. And some sites that they had set up specifically for teachers, some were only 50% booked, or 50% people actually showed up for a site. And what obviously happened is people were able to get a vaccine elsewhere, but just didn't cancel. And I think that what you're saying is probably very accurate. People maybe are hedging their bets, and I'll try Walgreens, and I'll try Kroger, and I'll try the health department and see where I get in first, and then forget or neglect to cancel. And it's so important to cancel that appointment, because if you cancel, you open it up for someone else. And so I guess I have two pleas to all Georgians. Please be patient, because there will be enough vaccine for everybody, and we're just trying to get it out as quickly as we get it. But also, please be respectful that if you do make multiple appointments and one comes through and you choose to go to that one, please cancel that appointment so that others can take their place.
Can you talk about why the state thinks it's a good idea to be running separate sites for My Vaccine Georgia and the health departments?
Well, I may let Director Stallings speak to that as far as the mass vaccination sites. I mean, obviously, we set our scheduling system up so we can control our sites. One of my frustrations dealing with this, kind of looking back, there's a lot you can't control. You know, we're not controlling where the federal doses are going. We're not controlling those shots getting in arms. Others are doing that. Same thing with a lot of our county public health structure with local boards, local directors, and I'll let Dr. Toomey speak more to that. But as you know, we got 159 county health departments, we got the districts, and then obviously we have Dr. Toomey and her teams, and I'll let her speak more to that.
I think it's simply a matter that we had already made a commitment to our Microsoft Dynamics, and we were building that out. GMA chose to go a different route. They're not the same scheduling system. In the ideal world, would we have exactly the same one in a single site? Yes, but this wasn't an ideal world, and we had already started and gone down a path and had invested a considerable amount of resources in both of these systems. And so we're doing, so it may not be the best, but the best is the enemy of the good. I think it still gives people the options to schedule at all of our sites, and our sites will continue even after the GMA sites close down. So remember, these sites aren't permanent. Our sites will likely be there for many months to come, because we will continue to be doing COVID work, both testing and vaccination in public health, in all the months ahead.
I think it's important to remember as well, this system's set up for things like flu vaccines and others, not the requirements that we've had for the coronavirus. So this is certainly new to all of us. Yep.
This is kind of touching on the same thing, but just to be specific, Governor, you talked about how some people canceled and wanted to go to other locations. That may have created some problems. But over at the Georgia International Convention Center, specific in College Park, they talked about it being more of an issue where there were 4,000 people booked into a 1,200 slot area. So can you refer to this particular location? And then there were long lines outside Mercedes-Benz.
So that was one of Fulton County sites, correct?
Correct,
ICC.
yeah, Fulton County Yes.
Yeah, you would need to ask them that question. Okay.
When I spoke with Dr. Paxton a few minutes ago, she updated me on that. And what inadvertently happened was an IT error on the part of the Fulton County staff, and they inadvertently booked or created double bookings. And so they had legitimate bookings, but it was an error on the part of when they set up the site. And it won't happen again. They realized what happened, and they were actually able to get enough vaccine to cover those double bookings. It just took a little bit of time and a longer line. But once they realized what had happened, that there had been an inadvertent glitch on their part in setting up the site, they quickly responded, brought extra staff in, brought extra vaccine in, were able to take care of everybody in line.
Okay, to be clear, though, this was not an issue with myvaccinegeorgia.com.
No.
They were coming onto the system. and
No,
had a glitch.
this was our public health scheduling system, and on the Fulton side, they had inadvertently programmed two bookings for a single booking, and so it was double booked. And they were able to accommodate everyone. They actually with a lot of agility, brought additional staff and vaccine to the site so that everybody could be served.
Thank you.
Could I get an answer? Do we know how many people are waitlisted, whether that be or Commissioner Toomey or Director Stallings? Do we know?
We'll follow up with you on that. I know I don't have that number handy. Thank you, everybody.